to the cloud. Okay, for the sake of the recording, this is the Board of Health meeting of what?
17.
September 17th. Keep getting the wrong month in there. And there we have a quorum, 4 members of the board, myself, Catherine Hilton, Noreen Pease, Garrett Simonson, Wim Levine. Arlene Reed is absent and expected to stay absent, and we may later have a visit. We expect to have a visit from Mike Hugo of the Massachusetts Association of Health Boards. So, first order of business, can we get those minutes approved?
I'll
I
move
did
to,
stand meeting, didn't I?
yep, I'll move to approve. Garrett.
Okay,
Second.
Go ahead. Wim seconded.
okay. All in favor? Noreen,
Yes.
Garrett,
Yes.
Wim,
Yes.
Cat, yes. Okay, so those are approved. Did we have any other agenda items? I don't think we did.
There was an air quality thing.
Oh, yeah, geez. So somebody who lives on Montague Road sent us an email asking the Board of Health to conduct some kind of air quality study having to do with the amount of dust that's being kicked up on Montague Road where it's unpaved during the drought, because he feels that it's a health hazard. Now, I hasten to point out that this person has lived there for 29 years. You know, and obviously belongs to the Pave Montague Road faction, and this is a new thing that he's thought up to try to bolster that side. Do we have any interest in or power to do this? I mean, certainly we don't have the technical ability. Wim, you're shaking your head. Go ahead.
Yeah, I just think that has to be gently turned down, because it's not only a bad precedent, because we have unpaved roads in town. You know,
All over, yeah.
they're not going to get paved ever.
Right.
So you could suggest a couple options. Keep your windows closed.
He's
Buy
already
an
doing that.
buy an air purifier.
Mhm.
And if you really want to do it, I know people on my unpaved road who I think they had oil sprayed on the road right in front of their house.
Mhm.
You know, so you can keep the dust down by doing that. I think a paving company, that's probably the kind of thing they would do. So
Oil the road.
yeah.
Mm.
But I think I think that's on them to do it. The town should not pick up the bill for that.
Right. I suppose not, but I also suppose that's not for us to determine, right?
Yeah.
I mean, they could get the road oiled, or for that matter, I suppose they could do it themselves. But it's not our place to say who should pay for it. Are there other thoughts about this? Hearing none, I wonder if we should also suggest that they take their complaint to the select board.
Can't hurt. I mean, feel free. Yeah.
Mhm.
I can't imagine they're going to get satisfaction, but
I can't either. I know this person and he's the kind of person who likes to kind of jab and poke and try to get results, and sometimes he's not entirely serious about it. All right. With your approval, I will send a memo to this person, or will respond to their email saying that such a study is beyond the scope of the Board of Health. That I'll make the suggestions that you mentioned, Wim, and I'll also suggest that they take their complaint to the select board if these measures are not sufficient. Sound good?
Sounds good to me.
Okay, will do. So, do you guys have anything to tell?
I think I might, but help me, team. I think we had the collaborative meeting last week, so I don't think I reported on some of the stuff from the collaborative. I can update the entire board. Kat, we talked about a few of these things.
Go ahead.
In terms of inspectors, the young man who was working for the collaborative has applied for the full-time job working for Greenfield. His name is Corey Hartman, and Greenfield was pretty certain they were going to hire him into their full-time position.
Well, what does that mean for the collaborative? We won't have access to him?
We will have access to him. Megan assures us that we will. We'll continue to have access to her and the director. And they have backfilled 2 other positions. However, they're starting at the same base that Corey started at, 6 or 8 months ago. They have to get all of their certifications in various areas. So they've hired another full-time person. His name is Jim Albert, Kat. And he has degree in public health. He speaks 4 languages, so that could be helpful in some areas. He speaks Haitian, Creole, Spanish, and English.
Wow.
Yes. So, and he's about to start taking the soil evaluator course. And the third person is, I think I told you about her last time. Her name is Anna Daford, Daford. She's going to be part-time. She has a master's degree in chemistry and apparently has worked at some wind and battery storage facilities. So might be able to enlighten us with some of the topics we're beginning to look in now. She too needs to start from scratch and get all of her certifications, but Megan's feeling confident that both of these persons will be able to move through all of these courses as they are offered and get their certifications quite quickly. So that, it's sort of mixed news. We're delightful to hire the caliber of people we have and been able to get. So, they'll be on the job learning with the others now, of course, with Corey and with Megan and with the director. The other thing, I don't know, we don't have any tobacco selling entities in town, but just, should something happen and someone wants to sell tobacco, both Leverett and Sunderland have developed draft tobacco regulations, so we could consult them if we needed to.
Okay, that seems pretty unlikely.
Yeah. Flu clinics. Kat, did you talk to Sarah about that? We're going to have a flu clinic, but we're still not certain as of the date. I think
She has not told me the date yet, and she's trying to get that from Katie Harrington. And it's a matter of scheduling at school, and I don't know what the holdup in scheduling the clinic is.
Okay.
But we've been in touch. She just has not. I assume that if I haven't heard from her in the last couple of days, it's because she doesn't have the information that she is meant to give me.
And Stop and Shop is going to be doing that clinic for us.
Okay.
So. All right, the other update is a little bit on SAFE funding is solid through FY27. There is going to be an advocacy day on October 23rd. There is a bus going from Franklin County to Boston with groups of people lobbying on behalf of continuing funding for the SAFE program. If anyone's, available and interested in going, I believe there's some information on the FERCog site on that. And oh, Garrett, help me. Who's the director in Montague?
Ryan Paxton.
Ryan Paxton has some additional information about the bus and the organization. I think the Association of directors, town and city directors of public health is getting the bus together. And that's all. The last thing was I did ask the collaborative to help us get Mike to come, and they've been very helpful in getting this organized for us. So I think it's been a nice team effort on that.
Excellent.
Yeah, I think we're pretty fortunate in the collaborative group we're in.
It
Me
does
too.
seem good, and they certainly are providing the services that we need in our moment of need here, which it occurs to me that I should talk about that a little bit. I am utterly frustrated with the district. We haven't had a meeting for some time, I don't know. We had a meeting, we decided to offer the position to a candidate. We scheduled an interview. The interview was so-called postponed, has not been rescheduled. I haven't heard another word. I heard basically from hearsay that there is another candidate, but I have not been officially informed of it. I haven't been sent the person's resume. The search committee has not met again, and I'm getting really mad about it. And the thing I'm getting really mad about is that we pay in advance. So at the beginning of the fiscal year, we pay for 6 months of services, and then after that, we pay for another 6 months of services. Now, 3 months have gone by, then we paid for 3 months of services that we have not gotten, and I want it back. And I told them that we would stay in the district if we could find somebody to serve. But I'm getting so angry about it. I'm getting really close to just quitting it. I mean, obviously, I can't do that all by myself. But I'd like to have your thoughts about it, if any.
The few meetings I've attended, Kat, I think I've attended all of them with you, but I've been mostly underimpressed.
Yes, it's an underwhelming group, and now that we don't have, we haven't had Charlie for a long time, and we don't have Claudia now, and it seems to me to be pretty much falling apart.
Yeah.
So I'm thinking that what I will do is I will request a meeting and have it out with these people. And what I think I understood Megan to say is that as long as we are budgeting and appropriating funds to pay for public health, the collaborative can provide services for us, whether we are spending those funds or not. And so that is certainly what we're doing. And
that's my understanding too, Kat. And I think there may be something about the funds may not be commingled with the other money that we're getting for the collaborative. So they may have to set up a separate account if there are other towns. I believe Leverett, for example, has also allocated money. And so that would have to go into a separate pot, but it's certainly doable.
And that's something that it seems like if we're going to be putting money into this, I'd like to put it into some place where we're actually getting the services that we need.
Right. I have sort of a side thought associated with that, Kat. I know we do have some funding available, and should we determine as a board and need to move forward with something with regard to developing regulations for lithium batteries, I'm wondering if we might need some more professional help or consulting help to put something together. I don't know. It just occurred to me. It seems like it's a pretty complicated subject
Mhm.
to tackle on our own, but I may be wrong about that. I don't know. I don't know if the planning board used anyone or did it themselves.
I don't know. I have talked with the chair of the planning board and said that we would try to work with them as we develop regulations, both for us and for them. Um, they have an article on the special town meeting warrant. That's a moratorium on data centers, but they don't seem to have anything. There's not anything current, but I know of about the battery storage systems. And I don't really understand exactly what a data center is, but they do define it in their thing.
Yeah.
So I don't even know the current status of battery storage systems in Shutesbury, if they are presently forbidden or there's a moratorium on them. I kind of don't know where we are on that. I was surprised actually to see that it was data centers and not the battery systems.
To what,
Well, it was just a thought that occurred to me as I was, reading the information and, thinking about what our next steps might be after tonight.
That's a good thought. I would assume that we can get assistance from MAHB, from other towns that have adopted regulations, as Wendell apparently has, from town council.
yeah, I was gonna ask, to what degree do we have access to Donna?
I'm not really sure. I think that we have the right to Donna's services, but we might have to just clear that with either the select board or the town administrator or somebody. We can't just go directly to her for a project of this size. If it's just a question, I can just send her an email, but this seems like more than that. But that is a good thing to find out. I'll put it on my to-do list. Are there other things we should know about?
So
mean-
related to MAPCO and the preparedness grants, so I'll meet with for COG staff on Friday to look at proposals that were submitted to FRCOG for the MAFCO projects for this budget period, which include the coordination services that were previously provided by Randy Cardinal was the name that you would see in the email.
Mhm,
And his firm was RSI.
mhm.
Um,
Are we not using them any longer or what?
so the way that FRCOG had to do it this time based on procurement procedures. So when the deliverables came out for this budget period, they were different enough that their procurement officer said we have to put it out for bid again. So
I see.
we can't just directly contract with RSI and Randy.
I see.
So they had to put it out for bid again, and based on the proposals that came in, RSI did not submit
Oh.
for that. So it will be a new vendor for coordination services, and then there's another contract for the discussion-based exercise that has to be done this budget period. So I'm on the evaluation committee for both of those contracts. So I'll meet with FRCOG staff on Friday to
So
make recommendations.
let me make sure I followed this. So there are two contracts that are being. that
Yes,
We're taking submissions for, and one of them is for coordination of, could you say more about that?
yeah, so coordination for the coalition, so MAFCO as a coalition, so basically managing, the meetings and agendas and all of that.
I see.
And then there's the project-based services around conducting an exercise for all of the Franklin County communities.
So do you expect RSI to bid for that?
They did not submit proposals in either of those service categories.
I see. Okay, so presumably we're not going to be seeing them anymore.
Yeah, I would say no.
And do you have other vendors who have bid on it, Garrett?
Yeah, so there were two vendors who submitted proposals for coordination services, and I think it was, yeah, 4 vendors for the exercise,
Okay, good.
which is pretty good for, I
Yeah.
mean, it's small dollar amounts for large firms to bid on. But it's also a very competitive time, just given what's happening federally. So I think a lot of firms are bidding on as many proposals as they can.
Good.
Okay.
One other thing, weren't there recently some more changes to the bylaws, Garrett?
Yeah, so Ryan
Go
Paxton and I did a
Yep.
pretty thorough rewrite of it.
Yep.
And that was presented at the annual meeting in June. And then there was some feedback on it. So basically the feedback was to move away from a steering committee and a full committee
Hmm.
and just have a full committee with co-chairs and more regular meetings of the full coalition committee.
Okay. And how's that defined now?
So basically it is that the full coalition meets monthly,
Okay.
and that each community is asked to appoint a primary and a secondary representative.
Okay.
Yeah.
And that means we need a secondary?
So ultimately, yes. So what's going to happen next is we finalized and approved the new principles of operation a couple of weeks ago. And so so right now FRCOG is acting as the coordinator
Oh, okay.
until we select a vendor for it.
Right.
So here in the next little bit, they're going to send out a notification to all of the Franklin County communities, asking them to appoint a primary and a backup.
Okay.
And
Well, sounds like WIM would be great.
well,
Very funny.
I'll continue to be the sacrificial lamb and be the primary.
And who might be the secondary?
I was suggesting WIM.
It'll be a light lift when I'll always go. So yeah. There was something else I was going to say. Well, and interestingly, I learned from FRCOG staff that the work that Ryan and I did on the principles of operation has now been adopted by some of the other coalitions. So they've taken that, the revised principles and have utilized them as well. So I think that's a good sign that we're heading in the right direction.
Great.
That's great.
We have only our best working on it.
So, so the coalition-wide or the MAFCO-wide exercise, when do you expect that would happen? Any idea?
So it was supposed to be done by the end of October in terms of DPH requirements.
Mhm.
We're meeting on Friday to select a vendor. So, I would say we're not looking until probably the end of January.
Okay. Is that going to get us in trouble with DPH?
No.
Okay.
No, what I always say about DPH is, what are they going to do? Are they going to take away our EDS plan binder?
Please,
What
take
are they
it,
going to
please.
do? What are they
Right.
going to do to us?
So what's speaking of EDS plans and stuff, what's the current status of that? Are we being thought of as a single EDS, or how does that?
Hmm.
Okay.
Yeah. I think for now, there was some discussion within Valley Health about how we might regionalize. And I do know from DPH staff that they're interested in updating the state guidance on EDS. So I had some contact this week with the state strategic national stockpile coordinator, who was, saying we're looking to update it. What do you think local boards of health and health departments want to see in that update? And, I said to her, basically we want to know what your vision is for what local public health is to do related to EDS post-COVID. What are your planning assumptions that you want us to operate off of? So I think that they're starting to look at it. The other part of this is that basically the strategic national stockpile is saying to the states that they need to start to think about how it is that they're going to replicate the SNS on a state level.
Mhm.
And not rely on the federal government to do it.
Good plan.
So,
Okay, because if it's just about standing up in EDS, we can do that with our eyes closed. It
Yeah.
seems like they might give us something more to do,
right.
Okay, well, I see that our guest has joined us, Mike Hugo of the Massachusetts Association of Health Boards. Hi, Mike, and welcome. Thank you for coming to our meeting.
Thank you very much. Nice to be here.
So,
So it's always better on Zoom, especially when I'm actually in Seattle right now. So
oh, well, thank you for joining us from such a distance. So we are interested in hearing about the possibility of enacting a bylaw or two from the Board of Health to protect ourselves from these new technological installations. What can you tell us?
well, I could tell you that you're not alone in that venture in Massachusetts. I think that you probably are aware of several other towns. I think that we're working probably with close to 10 municipalities right now on this very issue. I think one of the things that I find most disturbing about the whole thing is that these companies come in and they meet with everybody but the Board of Health in the beginning. You are an afterthought. Public health is always the afterthought. And they're doing so at their own peril. There's a whole bunch of new regulations that the Department of Energy Resources, I think it's called DOER, and the DEP are working on. We filed comments. I think I supplied the comments. I don't know if you've seen them or not.
Yes, you did.
Yes.
Yeah, thank you.
Excellent. Excellent. Well, that saves me half the time I was going to talk, because um, they I guess the problem is that even your town managers and your select boards, and in many cases your town attorneys, have no idea what the role of the Board of Health is in this. And I like to think that we can save everybody a lot of time, because if a Board of Health has their mind on stopping one of these best facilities from being put in, they're going to stop it. And it's better that they're at the table from the very beginning, because if you're inclined to stop the project from happening, you can save some companies millions of dollars in
Mhm.
citing costs and everything else, legal costs. And so the power that you have really is to pass a health regulation, a rational health regulation under Chapter 111, Section 31, which is the section that gives us the power to enact reasonable health regulations that don't go against any of the existing law in Massachusetts. And when I say don't go against it, you can take something that is properly cited by the planning board, the zoning board of appeals, the town manager, the select board, and they say this belongs here. You can still come in even after they've started to operate and say, no, it doesn't belong here. So the idea is for you to come up with a rational health regulation, acknowledging the dangers that were laid out in that memo that you've read, that in that set of comments. And we would help you certainly to get the scientific evidence that you'd need to listen to on both sides. Actually, we'll help you with finding people who are more opposed to it and let the industry bring the people in that will come before you and tell you how wonderful these are and how you can walk right up to the smoke while it's burning and breathe it in and don't worry about it and all of that, because those are the kinds of things that industry likes to talk about and say. But I'm certainly happy to assist your board. Cheryl and I both, Cheryl's out here actually with me right now. But we're both happy to assist your board with putting together some regulations that would govern where in your town, if at all, you would tolerate actually having one of these. Problem is, of course, they come in and they meet with your town manager first, and they talk about pilot money. And Shutesbury, I'm sure, is no different than Shrewsbury or Boston or any other municipality in Massachusetts where your schools are underfunded. Nobody knows where you're going to get the money from to meet those budget items to make sure that you have the best schools. And so when a company comes in and says, we're going to give you millions of dollars, we're going to take care of all of your financial problems, all you have to do is say yes, and we'll give you a pilot payment and I've seen them go way into the millions of dollars, the offers on the table, and town managers would be insane to say no. And when you put money like that in front of a town manager or a select board that's really worried about economic survival, it's very difficult to take that shiny object away from them once they're starting to look at it. And that's what we want to avoid. So if they know coming in that your Board of Health has a regulation, it's rational, and it would stand up to a legal challenge, then they may either go elsewhere or they may come to you first and say, these are the places in town that we think that we can make this happen within your regulation. If by some chance they got by it, we're working with some towns right now to do set assignments on not just these facilities, but lots and lots of different facilities that are up and running in towns and now turn out to be either noisome trades or nuisances. So that's it in a nutshell. And I'm really glad that you read that document in advance, because I don't have to teach that to you now, which is wonderful.
Right, right. So in that document, I saw that you asked for guidance and you asked for a statewide moratorium, and I wondered if you had any responses on that.
Not really. The answer would be no. I've had no direct responses on that. However, we've never been more at the table on something than we are right now. It would appear to me that they don't inhale or exhale without permission from MAHB. We are part of their whole regulatory process at this point. They have taken these comments, unlike anything that we've seen before. DOER has assigned people from their staff to work directly with us to make sure that any final rules that they come up with will have a lot of stuff in it, especially that the Board of Health should probably be the first, not like after planning or the office of the town manager. They should come to you before they go to anybody and find out whether or not they're going to succeed. I remember when I was on the board in Framingham, we had a real estate developer who spent $2.5 million. He had an option on 800 acres He was going to build 72 5-bedroom, 4-bath McMansions on this beautiful farm that he was about to purchase. $2.5 million in legal fees and everything else. And I went to the very first meeting of the ZBA and said, this will never fly in front of the Board of Health. And the zoning board chair told me to sit down and be quiet. Literally, he said, Mr. Hugo, we know what you're here for. We don't want to hear about it. And I said, suit yourselves. And so they went through all of the whole process. They got the planning, zoning, everybody approved it. And then we brought it to the attention of the court that we had given them a condition that they had to run a pump test during the month of August because these 72 homes were going on top of bedrock and there was literally no water there. And the people who do live in that neighborhood came to the Board of Health and said that when my neighbor flushes his toilet, my shower slows down. That's how challenged the water supply is there. And we said, fine, it happens mostly in August. So we told the developer, do a test. And after the court came down with their ruling, I think like in September or October, right after August, but it was a year later, and said you have to do it during August. And the developer said, well, because of these people, we're not going to, like it was Mike Hugo's fault. Actually, they used my name. They said Mike Hugo blocked this, but who cares? So
But you were proud of that.
I wear it as a badge of honor. I'm sure you can all relate to something like that happening.
For
And
sure.
so that is actually an example that I gave to DOER and said we don't want our boards to be in the position I was in with my board on a real estate development. We want the boards to be at the table from the get-go, from day one. So they are really respecting that, and I'm a little surprised, Catherine, to be very honest, with the reception that they've given this whole idea of including boards of health, and to the point now where, we've never had a good relationship with MMA. It seems like MMA has the interests of every department except public health. And now we've got people from MMA that are calling Cheryl and calling me every time that anything like this pops up, and they're asking us what their position should be, for which I've never seen before on some of the scientific stuff. So I don't know if it's a dawn of a new era or if they're just finally saying, yeah, I guess we never thought about that.
Either way, it's a good thing.
It is a good thing.
So we've also seen the regulation, I think it's a draft from Wendell, that imposes all kinds of citing and other kinds of restrictions. Are there any regulations or draft regulations out there that are for basically prohibiting them from a town?
Not by regulation. I'm trying to think of there is a town where the company just said, no, forget it. We're not dealing with all of this. And I don't remember if it was Westfield. I think it was a W town. And I know it was.
There are a lot of those.
There are. I live in Wellesley, so that's a W
There
town.
you go.
But in Wellesley, very interestingly, we have a battery energy storage system in Wellesley. And it was sited on municipal property where nobody lives anywhere near it, and there's no threat of sound or anything, and it's tiny. It's only got 3 or 4 batteries, but it's still. I'll come up with that, and I'll get you some information on that for sure.
Okay.
May I ask a question, Kat?
Please do.
Toward the end, you had a whole list of factors you recommended we should take into consideration when developing a regulation. And I also heard you say that you and Cheryl are involved in perhaps writing some draft regulations for towns and small cities right now. So
Correct. We're not.
I assume those two relate.
Yes, they do. If you've read this document, you're gonna see an awful lot of it in those regulations, because we're using what you've read as the rational basis for a Board of Health to do this, because there's plenty, even though I didn't cite a lot of the studies and stuff, everything that I put in there, I'm prepared as I was writing that document to begin with, I was prepared for somebody from DEP to say, prove it on any one of those items. And we can do that. We have studies. There's lots of science. These things are scary because they're so important to have, yet they're so dangerous.
So,
And
go ahead.
can I just a follow-up, Kat, please?
Yes.
What's your time frame for getting a draft set of regulations developed, Mike?
I think within the next 2 months, I'll have something. I have to have it. It's everybody needs it. It might be that I get back to Boston and Monday morning I wake up and say, damn it, I'm just going to do it. It's just a matter of sitting down and biting the bullet and knowing that nothing else is going to get in the way.
Thank you. Thank you, Kat.
I noticed that the Wendell regulation does seem to have quite onerous requirements, and I wonder if those are meant to be to have a chilling effect on anybody that might want to come to their town.
I'm sure they are.
Mhm.
I'm sure they are. And that's a question that I think that you all need to decide what your real feeling is about it, and not all of you, but one of you who has a good sense of it should let me know which way you want to go, because I can draft something that's so onerous that they'll say, not those people again, that came from MAHB, want nothing to do with it. Or I can draft something that says, we really love the idea, but we need to make sure it's in the right place. And there's all kinds of different ways of making that regulation.
Right, and I'm not sure that we haven't really discussed it as a board, and so I don't think we were sure where we come down on that.
Right.
And Wendell, as you know, Wendell is our next town over, and they have some of the same conditions that we have. They don't have any municipal water supply. Everything is private wells, and it's heavily forested. And the thought of having an uncontrolled fire out here where we're supposed to be a carbon sink for the rest of the state, those things are really scary. And I can't really imagine any place in town where there would be an appropriate site for one of these. I don't know if any other board members have a thought on that, but I can't think of a single place. It's forest everywhere, and quite a lot of it is Quabbin watershed that we have to keep in mind.
There's a lot going on in the whole Quabbin watershed area. We're working right now with Hardwick and Barry
Mhm.
on protecting the Barry wells, because there's a closed, I'm sure you remember the landfill in Hardwick
Mhm.
that was closed, I think, in 2007. But there's an aquifer that goes adjacent to that, and that feeds town wells in Ware. It goes directly to their wells. That's where it ends.
Uh-huh.
So
see.
we're working on something to do with them right now. The town of Orange is making some very rational arguments about the fact that this is too close to their municipal wells.
Mhm.
And if there were to be a fire and any water, which I can't remember off the top of my head how many millions of gallons it is, but it takes about 4 days to get one of these things under control. That's
Mhm.
not to put it out. That's
Pumping constantly, I
control.
suppose.
Right. It's like, I can't remember. It was like hundreds of 300 million gallons. It was some
Uh-huh.
ridiculous number,
Mhm.
but that would destroy any kind of drinking water supply. Because it's right there. It's right at the town wells.
Right, we're already seeing, in some places in town, we're seeing the aquifers lowering.
Right.
So we're concerned about that, and we don't want to put our water supply, and especially being like a hilltop community. All the water is going downhill from here, and we're anxious to protect that, and we don't want it to be used to put out a fire, an enormous runaway fire.
Right. 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 And the runaway fires, to me, looking at it from a public health angle, aside from the groundwater saturation of filthy water that is washed all over lithium and carries all of those constituents with it that you saw on that list. Aside from that, I worry. Well, I worry about a lot of the things that are going on there, but just the fact that you have the smoke.
Mhm.
Nobody talks about the smoke. That's why I made sure that I had that in there, because finding information about what's in that smoke was kind of difficult to do. And nowhere will you find something that says a lithium ion battery used in one of these facilities would generate this. And it's hard to find that kind of information. So I had to go looking at lithium ion fire danger from bicycles, you know, the electric bikes and the skateboards and all of that.
Yeah, we had one burn up a house in Amherst just a couple days ago.
Oh, really?
Yeah, it was from somebody's bike.
Yeah, yeah, they're dangerous.
Hmm.
And yeah, I mean, it scares the hell out of me. My son-in-law keeps his parked right in the front hallway of their apartment in Brooklyn. You know,
Ooh,
I said, how about if you put that on your back porch? You know, just what a guy wants to hear from his father-in-law, right?
right. Exactly. Do you think we need to have a big aquifer study? I mean, we don't have a formal study of where the water is, really.
If you're going to base it on that, you
Mhm.
probably should. If you're
Okay.
going to base it on something else,
Mhm.
then maybe not so necessary. But if you're going to hang your hat on the fact that you're protecting your aquifer, I think that you might, and there might be data that you don't know, and that you know, I don't know because I haven't looked yet, but there might be data out there already that might be sufficient for you to look at. I'm just trying to envision are you west of Amherst?
Northeast.
Northeast. Oh, so really Quabbin land.
Yes.
Yeah.
Yeah.
So
Yes.
you're on the
quite-
west side of the reservoir then?
Mhm.
Correct.
Mhm. Right, right, and we're just uphill of Route 202, and a bunch of the land on there, on that side, is owned by the state as Quabbin watershed land.
Right, right. Okay. I know right where you are then. Okay.
Mhm.
I wonder if there's already enough watershed data from the state that we might be able to dig up.
There might be, we had a former board member who was quite interested in the water supply, and he may have some data for us. I'll ask about it.
Yeah, yeah. Because the more of that you have, the better, especially if you're going to pass a regulation on it, because otherwise it could look arbitrary and capricious.
Right. Right, which is why it would probably be wise to not hang our hat on one single hook.
Right.
To
Well, there's plenty of hooks.
yeah, right.
You look at that memo, yes.
And there's an
There's a lot of
infinite
hooks.
number, it seems, yeah. Okay,
Mike, we have a special town meeting later this month, and on the warrant is an article that I just want to bring it up here real quickly to make sure I'm representing it correctly. So, an article on a moratorium and prohibition of data centers. And so, if that warrant were to pass, would it still be advisable that we pursue a regulation?
For data centers, what are they opposing them based on?
Yeah, so basically it reads the town of Shutesbury shall enact a moratorium on the application for or building of new data centers as defined in section 13.2 of the Shutesbury bylaw. The purpose of the moratorium is to provide the Shutesbury Planning Board with sufficient time to research and understand this complex issue, so that reasonable regulation can be developed for consideration at the annual town meeting.
What is it though in the data center that they're afraid of? Do you know?
Let's see.
I mean, there's something obviously driving this, and
So my understanding of why this came to our attention, Kat, and correct me if I'm wrong on this, was that someone approached the planning board to ask if we had any bylaws or regulations related to data centers, potentially a developer. Was that your understanding from Michael?
I did not get an idea about where that came from.
Yeah,
let's find. Can you find that out, Garrett, and get back to me on it?
yeah.
Shoot me an email once you, because I'm wondering if I don't see this as a data center unless they're thinking of putting a best facility as part of the data center itself, which could be, because you want to drive the machinery with it, the computers and stuff.
Yeah,
Let's see if we can find that out, because
yeah.
you might want to weigh in on that as a board, actually.
Right. Right, but apparently they haven't, uh, put anything out about the battery storage. Unless they already have that in the new solar bylaw. I don't know if anybody has looked into that.
I haven't seen anything.
Yeah,
on-
okay. Well, we'll look into that and see what they've already done as a planning board. And, I have been in touch with the chair of the planning board and said that we would try to work together as the two boards.
Absolutely, yeah, absolutely. That's the best way to do everything, so,
For sure.
yeah.
Do we have other questions for Mike?
Well, I'm here for you guys, for anything. You've got my email and,
Mhm.
you all have I think you all have my phone number. If you don't, it's right on my email.
Okay.
And just feel free anytime to call.
Well, thank you so much. We really appreciate that. And I expect you'll be hearing from us again.
I expect I will. All right,
Okay.
great.
Oh, thanks a lot for coming tonight.
All right, thank you.
Thank
We'll
you.
see you. Bye-bye.
Fine.
Bye. So it seems like we've got some thinking to do. Has everybody had a chance to read the draft regulation from the Wendell Board of Health?
No.
No. As I indicated, it's full of restrictions and requirements, and it seems to me to be fairly onerous for an applicant to approach it. And I don't know if we want to, if it isn't the most prudent thing to structure a regulation from our board in the same way to basically discourage this rather than to out and out forbid it, which might be, as he said, what's that expression? Unreasonable and capricious, or something like that.
Ken, I'm sorry, I may have an ignorant question, but did you forward that to us? How did we get that regulation? Do
I
others have it? Because
I thought I did, and I thought you had it and forwarded it to me, actually. So,
I
but
think it's contained within what Michael sent.
was?
Yeah,
that's right.
I
What
think
Kara sent.
if it might be within a link. It's sort of if you
Oh,
click on it, it looks strange. It
Mm.
looks like a document within a web page. It looks really unusual, and you kind of have to scroll through it to figure
okay, because
out.
I looked at all those documents and I didn't see Wendell, but maybe I didn't look closely enough.
So I'll
It's in a link.
if I can, yeah. I'll see if I can find it again and push it to Kat.
Okay, great, thank you.
Yeah, I'll try to, because it did come in one of those things from Michael, and I'm pretty sure that that I sent it to you. But it's 8 pages, but most of it, I mean, you don't have to study it closely to see that there are many requirements, both general and specific, about every possible facet of this, including providing training for emergency responders. It specifies how the lighting is going to be, and how the sound is going to be, and how the air quality is going to be, and the sighting, and how they have to, the applicant has to pay the fees for all these things. And it is very detailed and very specific. So we could go that way and just be very, very restrictive. And of course, also in their purpose, they they discuss the whole question of all different possible public health impacts from putting out fires to the smoke, as we were talking about, to light pollution, noise pollution, and every other thing.
Pat, I think I, for one, would like to perhaps get a meeting together with the planning board if possible, or this is just a thought to see, what they're thinking. They've been involved in this and for a lot longer time than we do, and I'd like to see their perspective. And I also suppose when we go to the special town meeting, we'll hear from other, I imagine there will be some public testimony that will be taken. I don't know.
But the thing is, their thing is about data centers specific,
Okay,
and they don't seem, at least for this meeting, they are not addressing the question of battery systems.
so you're sure there isn't? Because I wrote that down as a question. Is the best center included in this data set?
I'm not sure that it
Yeah,
isn't.
okay.
I haven't read the documentation for it. And
Right.
I haven't read, now Michael sent us all also, and I'll make sure that you all have it, the text of the new solar bylaw. And that presumably addresses, at least to some extent, the question of energy storage. It has to in some way.
Mhm.
So that may be already on the books. Whatever position they've decided to take on that.
I don't know enough about data centers, but my assumption would be that any data center would have on-site energy storage, battery-based energy storage. I mean, I could be wrong, but
That seems reasonable, doesn't it?
Yeah, and it also occurs to me, I think I must have read something about that, because didn't Gail Huntress comment on it? And I'm wondering if we should get Gail's opinion on some of this as well.
Mhm.
I don't know. I don't understand the whole
Well, I don't either.
array of things well enough.
Yeah, I feel kind of at sea about the whole thing, and I'm not sure how we can go about getting educated about it. Well, I guess we can start by looking at the solar bylaw and also at any documentation that goes with the warrant article from the planning board. And yes, I think we should try to get a joint meeting with the planning board. Anybody know how often they meet?
No.
Let's see. Okay,
the good news is that if the moratorium passes at special town meeting, it gives us 9 months. Because will be effective until annual town meeting.
right.
So give a little time to.
Right. On the other hand, it would be good if we're going to pass we don't have to do that at town meeting, do we? We just do it as a. Right.
We probably have to have a public hearing.
We have to have a public hearing, but we don't have to, it's not like a bylaw that we have to do at town meeting. We can
Right.
pass it ourselves after a public hearing. Well, it sounds like MAHB is going to be providing us some help and some actual templates.
Yes,
Very
Mike said within
soon.
2 months, so, and maybe sooner.
Mhm.
Sounds like other towns are urging him on as well.
Right, and I would like to see which are the, what other tax some towns are taking, and we've seen what Wendell is doing by just putting a lot of restrictions all around it. And I don't know if there's any place where they're simply prohibiting it.
I don't either. I just know from the paper that Plainfield has also had a rather large company come in and want to, you know, build an installation there.
Uh-huh. For battery storage or? for
Yeah, I think so, yeah.
Uh-huh. And is there news of a response or too soon?
You know, I have a friend who is on the planning board and I could contact her and they
Mhm.
just had a public hearing on it and
I
it
see.
was just an article I read in the paper. That's all I
Mhm.
really know, but I could contact her. She may even be chair. She was quoted several times in the
Mhm.
article.
Yeah, and I think Mike mentioned Barry. I was driving through
Yeah.
Barry the other day, and there's a bunch of yard signs out encouraging people to go against a battery storage facility there.
Mhm. Are there any places where it's appropriate to have such a facility?
In our town, you mean?
And anywhere in the world?
Oh,
In our town, no, I don't think so. But, I mean, what's a good place for such a thing? Out in the
Well,
middle of
Mike
the
talked
desert.
about the facility in Wellesley in his town that was on a piece of public property that wasn't within close proximity to any homes, but he said he thought it was a small installation.
Yeah, I said it was only like 2 or 3 batteries, and
Yeah.
I don't know what that means in terms of the size and the potential impact of it.
Yeah.
Well, I talked the other night with Nate Murphy. We went to that thing at the fire station, and he was imagining that potentially a very small operation of just a few batteries might be something that we could manage to site in town. I'm not convinced, but I don't know. Obviously, we don't want a great big array of dangerous batteries here. I don't know if it's possible to have a few. On the other hand, if we have a regulation such as they seem to be getting ready to pass in Wendell, or maybe they already have, this is a draft that I have. Um, um, I would imagine that it would be too onerous for such a small return.
I'm sorry, Kat, 2 owners for such a small,
Such a small return on their
Oh, yeah.
investment. They would have
Yeah.
to invest a lot, and it would be a very small
right, okay, see what you're saying.
installation.
Yeah,
And it doesn't seem like it would be worth it.
so this, I'm not familiar with this topic at all, but it sounds like it has nothing to do with a domestic, like a power wall, battery storage for residential, solar energy production.
No, I don't think it's that. Those are big commercial operations, or like, I think one of the purposes of them is to take and store the energy that that they get from solar arrays. And why that just doesn't go into the grid and bypass batteries altogether, I don't understand. I just don't know how that works.
Uh,
I have another question. How many members of the board are going to this special town meeting on the 30th or can go?
I'm going. Nobody else?
Plans, but it seems like it's kind of important that we
I think
go.
I think I'll be able to go, yeah.
I think I would be able to go. I don't know offhand.
The Tuesday.
I think it's what, the 30th, so it's 6:30,
Yeah.
something like that, Kat, is that
Yeah,
right?
it's something like some weird number like 640 or something.
Yeah,
The 30th at 6:30.
Okay. Yeah, I'll be there. And Garrett, however, yeah, I mean, at the moment, we just don't know how this data center interest of theirs, how that intersects with the battery storage.
right, right.
We can try to find that out beforehand.
All right, well, let's try and meet with them as soon as we can, Kat.
Do you think that could happen before or should happen before town meeting? I mean, it's coming up, you know, what, 10
It's-
days away?
It's next week, isn't it? Yeah,
Yeah,
yeah, 10 days maybe.
right. Today's the 17th and it's the 30th.
Yes,
Yeah, so it's less than 2 weeks. I'm thinking that maybe they're probably quite busy with their thing. And maybe trying to meet with them after special town meeting might be more fruitful. We'll be able to kind of course, they'll know what's going on with their moratorium. And they won't be getting ready for that. Right, we can actually work on finding common ground and seeing what things need to be done on both sides.
that's fine with me.
Okay, I'll reach out to the planning board. And see how they feel about trying to schedule a joint meeting. I don't know when they have their meetings. Let me see if I can figure it out. So if I go to
Shutesbury.org and see when they,
yeah, I'm looking at the calendar and trying
Yeah,
to see.
right.
So I see that there's a planning board meeting on Monday, October 10th. No, it's November 10th, actually, so they must have a regular schedule. I don't see any planned for October. So anyway, I'm seeing a 7 p.m. meeting on November 10th and December 8th. So it's possible they only meet once a month, but that would surprise me. Anyway, it seems that they meet on Monday evenings. So possibly we could join one of their meetings or they could join one of ours, whichever works better.
Yeah, I mean, we meet more frequently, so maybe they would come to one of ours. I'm just thinking of time frame, and if that's one of our
Yeah.
first steps, it would be good to meet with them probably sooner rather than later. Following the special town meeting, that is. Maybe we can meet with them in October sometime.
Yeah, I don't see any meetings scheduled for October, but that doesn't mean they're not gonna have one. It
But I'm
looks,
suggesting maybe they could join us in one of our meetings since we're
yeah,
twice a month.
right. Okay. All right, I'll see what they might be willing to do.
Great.
So my tasks here are to reach out to the planning board and to make sure everybody has all the documentation. And I want to read up on things. And also to find out about Well, let's wait and see. We might not need Donna's help, particularly if MAHB is going to be actually providing us
Mhm.
with language.
I'd,
All right,
I'd like for us to at least give her a heads up that we're talking about it
that's a really good idea.
so that she's aware.
Yeah, just for her information. Okay. I'll send her an email. Okay,
Okay, and so I guess my short-term task is completed. Madam Chair.
I guess so. I'll make sure you get that Wendell regulation.
Yes, thank you.
Okay, is there anything else that we need to talk about or assign or suggest or?
No, I think we're lucky to have access to MAHB
Yes,
and I think we pay membership to them as a board, don't we?
we do.
Yeah, good.
We do. It's something like $150 a year now.
Yep.
Good.
Yeah.
And
Mike
Yeah.
is a great resource.
Yes.
yeah, he seems really great. I've had a few emails with him, but I've never spoken to him before, and I really liked him. He seems
And
very
Kat-
helpful.
Kat, you do have his email now, and do you have his phone number? Because I have his phone number too. If you need it, I can get it to you.
I think I have it, but if I don't have it, I'll ask you for it.
Okay, very good.
I think it's on this thing.
Great.
Okay,
I move we adjourn.
do I hear a second?
I will second Garrett.
All in favor? I'm in favor. Noreen,
Yes.
Garrett,
Yes.
William.
Yes.
Okay, well, meeting is adjourned at 8:14 PM. Thank you all very much.
Thank-
And
Thank you, Kat.
you.
see you soon.
Bye. everyone.
Thanks.
Good night.
Bye.